Hey, everybody. Welcome back. It's Robert Dinan at Luxury Living Florida. All things luxury, all things Florida. And today I have a wonderful guest today with us. It's Dr. Ken Kaufman with Sarasota Sports Medicine. Welcome, Ken.
Yeah, I'm excited to be here.
Good to see you.
This is
absolutely.
awesome.
Absolutely.
Yeah.
So why don't you give us a little background on yourself first off, and then we can get into your business that you're running now here in Sarasota.
Absolutely. Yeah.
Great operation, by the way.
Oh, thanks.
Yeah.
Thanks. It's a lot of blood, sweat, and tears. Let me tell you that.
Indeed. Just like every small business owner.
Exactly. Going through the grind. No, I grew up in Michigan and moved down here right after, my first attempt at a semester at college. I had a good time. I majored in beer and in girls.
Yeah, that happens.
Yeah,
that happens.
Yeah, exactly.
It does.
So, but
a good time, my friend.
Yeah, I did have a good time. Yeah. So, but I moved down here in 85, so I've been down here for a good 40 years.
So you're a Floridian, my friend.
Well, yeah, exactly. I don't, I joke that I moved down here in 85, went back for a visit in 86, and I never went back.
Never went back.
Until, 2 years ago.
Yeah.
So, but no, I moved down here and worked for my parents. They opened up a print shop down in Venice. My dad took early retirement and opened up a business down here. And I worked for them for, a couple years and was going to school part-time. And I worked too many 80-hour weeks. Little did I know that I'd work more than that when I owned my own business. But I worked too many 80-hour weeks, and I was like, I'm going to go back to school and really, get my degree. And there was a chiropractor down in Venice that was my mentor, and he kind of inspired me to, look into chiropractic as a career, and that's what I ended up doing. I went to Life Chiropractic up in Atlanta, Georgia, and moved back here in '93, and moved back with a new baby and, trying to figure things out. And I did an attempt to work with the doc that inspired me down in Venice for a short period of time. And I realized that it was much different working for him rather than having him mentor me. And so
that does happen.
Yeah, it does. It does. So,
yeah, for sure.
And of course, at the time you get out of school, you think you know everything. So that was probably part of it as well. But I'm glad I went out on my own and I opened my first practice down in Palmer Ranch by the Target down there.
Great location.
It was a good location. I was in 800 square feet.
Well, compared to Venice at that time, Venice is, it's how it's grown now is absolutely insane.
It's insane. Since that time, it's blown up, just like everywhere else.
It was 85 in Venice. You were there?
Yeah, 85 is when I first moved down there, and when I came back, I wanted to be, in Sarasota. I didn't want to be down in Venice because, I was young family, that type of thing. And
85 in Venice, Florida. It was a different world.
Oh, it was completely different than it is now. Lakewood Ranch was, what in its infancy, maybe the embryonic stage.
Yes.
It was really
even into a little bit before '08. The road stopped.
Yeah, exactly. Yeah.
All those side roads weren't even there in Lakewood Ranch.
Yeah. Who in the hell would live out here?
Yeah. I know. East of 75.
Yeah.
I remember when I bought in Venice in 2000, and I bought in Venice Golf and Country Club.
Oh yeah.
Which is what everybody considered at that time. Oh my God, you're all the way out there.
Yeah, right.
And I was like, all the way out there. I'm like 7 minutes to Venice Beach.
Yeah.
What are you talking about?
Yeah, right. Exactly.
But there was none of that. All that stuff that's there now, that Publix, the roundabout, all the
right
big stuff that's come in. There was a McDonald's off of 75, and I think a Cracker Barrel, and a small hotel when we bought. But now it's larger hotels. the car dealerships.
Oh yeah,
restaurants.
It's just blown up.
Tractor Supply over there.
Yeah, right.
It's wild. It's wild.
Yeah.
So talk a little bit about your business here in Sarasota and kind of your ideal client and what you're doing to help people feel better, look better. And
when I first got into practice for the first half of my career, I was your traditional straight up chiropractor adjusting spines and teaching people about health and wellness and that type of thing. And then
that's kind of you were. Now it's a big buzzword, right? Health and wellness.
Yeah, right.
But at that time,
it was like a new concept.
It was a new concept, yeah. And a lot of people, especially the big insurance companies, right? Chiropractic was like voodoo medicine, right?
Right.
Which is, we all know is not true.
Yeah, well, in 2010, the Baltimore Orioles, they relocated their spring training to Ed Smith Stadium in Sarasota. And through contact that I knew, it's not what you know, who you know. The Orioles medical coordinator reached out via email and said, "Hey, we're looking for a chiropractor to take care of the athletes. Would you be interested during spring training?" And
No,
I'm like,
that's all right. I don't want to.
Hell yeah. So ultimately, through a selection process, I became their team chiropractor and was with them until right around COVID. But yeah, taking care of the athletes. And what was really the biggest benefit was the fact that I was able to see how these athletes were treated in an integrative way. So not only was I there, I was just doing chiropractic care, but they had, team massage therapists, acupuncturists, team physicians, orthopedics, strength and conditioning,
the whole medical operation.
The whole thing.
Yeah.
And so, seeing that, I was inspired to gradually start to try to incorporate some of those modalities and some of those treatments into the chiropractic practice. And so, over time, it morphed into what we have now, which is Sarasota Sports Medicine. So Sarasota Sports Medicine, we still do chiropractic, but we also do different soft tissue techniques like Graston technique and cupping and things like that to help with pain. We do class 4 laser therapy. We do acoustic shockwave therapy, which is beneficial for, reducing pain and treating, shoulders and elbows and much more than just the spine, which we still do. In addition to that, we, incorporated corrective exercise, which is essential when somebody has, they're aging and they have aches and pains. Many times a lot of it comes from deconditioning, from sitting too long, for improper posture and things like that. So it's one thing to adjust and do some soft tissue work, but you have to train the patient and get them active and moving and stretching and strengthening themselves. And then over the last probably 5 or 6 years, we've added in things like dextrose prolotherapy, which is a injection therapy, a regenerative medicine injection therapy that can heal tendons and ligaments. We do now peptide therapy, which is kind of...
That's very interesting to me, the peptides.
Yeah, we'll talk more about that. So peptide therapy helps support connective tissue during healing, plus there's all kinds of different peptides that we don't even get into, but they are on the market. And then we also do...
And some are not anymore, right? Some of the peptides they took off, like 157? Right?
No, BPC 157. We have that compounded, but they had to change one amino acid in the chain, so it's not like the original BPC 157,
right, yeah.
But we can have that compounded, and it works just as well.
Okay.
So, and then we also now
I thought it was working too well, and they wanted to get rid of it.
Well, that's part of it. I don't know. There's a lot of things that happen in with the FDA, but then we also now do allogenic stem cell injections, which is really exciting because it's an alternative to knee replacement when somebody has quote unquote bone on bone arthritis.
Like I went through.
Yeah. So many times a bone on bone arthritis is diagnosed through an X-ray, which it's a buzzword that gets thrown around a lot.
Yeah, the word arthritis too, right?
Yeah.
Really inflammation, right?
Well, it's inflammation, it's deterioration of the joint and the cartilage and things like that. But, stem cell injections can regenerate those tissues. So we have, many patients have been through our process that...
So talk to me about, let me interrupt you for a minute. Talk to me about inflammation.
Okay.
There's a lot of schools of thought on inflammation.
Mm-hmm. There's one school of thought on inflammation.
There's one?
Yeah.
Okay.
Yeah.
Well, but maybe then there's some other theories or concepts. Maybe,
Okay.
Because,
well, let me explain it this way. And this is, in my mind, and it's backed by research, is that there's basically 2 types of inflammation that can happen in the body. And one's detrimental and one is beneficial. So the detrimental inflammation in the body is the chronic systemic inflammation that develops from poor lifestyles, lack of sleep, poor, elevated cortisol levels from stress. And that is a drain on the immune system that can, suppress immune function, leave you susceptible to illness and things like that. And that comes from the food we eat, the environmental toxins that we have in our...
which are a lot.
Yeah. So the water that we drink, the preservatives in the food, fast foods, things like that. Those are things that can cause chronic inflammation in the body that can lead to things like cancer and heart disease and things of that nature. The other type of inflammation is actually beneficial, and that is the acute inflammation that happens from tissue injury. So you twist your ankle, for example. The first thing that happens is you have an inflammatory reaction.
Yeah, right.
Now, what's important is, and why it's beneficial, is that there are 3 phases to healing of any tissue. There's the acute inflammatory phase. There's the proliferative phase where the body starts to heal the tissue. Mm-hmm. And then there's the remodeling phase where that tissue becomes, stronger and like other tissue. And so in order to have those 3 phases, they have to happen in order. And so
Right.
you have to have the acute inflammation in order for it to happen. Now, what the traditional previous approach was is anti-inflammatory medications, put it in ice, cortisone injections, and things of that nature to stop the inflammation. And that's, what do I do about the inflammation? Well, you need inflammation. And in fact, some of the regenerative medicine injections actually create inflammation.
Right.
It's because it's triggering the immune system. And so, we could talk for hours on why we don't ice injuries anymore.
Right.
Okay. So I learned that working with the Orioles. And when the trainer said, I was like, why aren't you icing his knee? It's swollen. And they said, oh, we don't ice injuries anymore. And I went, huh? What? Back then I was like, what are you talking about? And so going down the rabbit hole and really learning and understanding the physiology, that you need inflammation in order to trigger healing, now it makes sense.
Right.
So, and that's gradually, and it's kind of trickling down from professional sports that we don't ice injuries anymore. And so it takes a while to get to the, the soccer moms and whatnot, not to put frozen peas on the knee.
Yeah, right.
Yeah.
Yeah, the old frozen peas. Huh?
Yeah.
So talk a little bit about, Sarasota Sports Medicine, right?
Mm-hmm.
I mean, you're not just helping athletes, right?
No.
I mean, anybody can come see you for any of these varies of treatments that you offer.
Mm-hmm.
What are you seeing the most as far as, the new customer or new patient, I should say, for you, new patients that are coming in to see you?
Well, just yesterday, I'll just use yesterday as an example.
Because your
over the last
location,
few days.
why don't you share your location?
The location is just south of Bay Vista on Cattleman Road.
Right.
So it's easily accessed. And that's why I moved to that from South Sarasota to that location, is because of the easy access from 75. Because we draw patients all the way from, I had a patient a couple weeks ago from Orlando come see us, and then all the way down to Naples. And so,
I mean, it's a great location as far as getting to the spot.
It's easy
it's
to
a
get
beautiful,
to.
beautiful spot.
Yeah, and plus lots of parking.
Plenty of parking.
Yeah. Anyways, so yesterday I had a patient that was told he needed a hip replacement. He doesn't want to have surgery. He doesn't want to, spend $15,000 out of pocket, which he would have to do for the surgery because of his insurance plan. And so he came to us as an alternative to, and he's like on board. So, he's in the process of getting an MRI to make sure he updates everything. And then yesterday I had a patient that she actually had a stem cell injection in her knee a few months ago, and she re-aggravated it. And so she's in for some palliative treatment just to, kind of calm it down, and, should be on a good path. We have, patients that come in that have, spinal abnormalities that maybe they're not a candidate for stem cell injection or regenerative medicine injection, but they're in for chiropractic care or soft tissue work and corrective exercise to help rebuild, deep core stabilization to help, get their spine healthy.
Yeah, and get their lifestyle back
right.
too, right?
And so, and then we have patients that have torn rotator cuffs, torn labrums in their shoulder, where, we can do a stem cell injection if there's arthritis in there, or we can do the prolotherapy.
Well, we are in Florida. There's a lot of golf, a lot of tennis,
a lot of golf.
Yeah.
Actually, I'm very excited, and I can't share too many details, but I have a contact. My son is actually a golf pro, so
I didn't know that. Wow.
Yeah. He's a golf pro at the new Calusa Country Club up in Bornside up in Lakewood Ranch.
Yeah.
So
nice place.
Yeah. So I have a program that I developed called Golf RX, and that is basically combining swing mechanics and correct posture and drills to increase, spinal range of motion, take stress off of joints. So if somebody has very common, they have either a shoulder problem or knee problem, and their golf swing is affected because it hurts when they swing.
Right. Because probably incorrect swings. Right?
Well, incorrect swings, overswinging, just poor mechanics.
Right.
So taking, where an approach where we look at how do we mitigate the amount of stress on a knee if there's a knee problem. How do we mitigate that through the golf swing, but make it repeatable and not decrease performance?
Right.
And so, which is like, trying to thread a needle, but it's doable. And we've, had some patients kind of go through that process, and, we're able to kind of look at things. And then, in my son's case, his name is Nick, but in his case, it was the first time I ever saw him, teach a lesson. And I was like, damn, that kid knows what he's doing, because, the client.
Smart family.
Yeah, I was like, wow. It was the first time I saw him. I was like, damn, I'm impressed. That's my boy,
Nice.
But, the client was like, all of a sudden he was like, oh, that feels better. And then he's like, smoking the ball, And so I'm excited about that program where we'll go to various clubs around the area and teach that in a workshop, a hands-on workshop. So I'm really excited about that.
That should expand like wildfire, man.
Yeah, because, who doesn't play golf that's not in pain at some point or another from, just some of the crazy swings that you see out there.
And then, as you get older, you get more time to play golf and you're playing more golf.
Yeah,
and,
right. And stress and everything more. But yeah, that's, the ideal patient is just, it's usually somebody in their, mid 40s to late 40s or late 50s or whatever and beyond that have, various joint issues and spinal problems, that type of thing. And we have a lot of tools in the toolbox to not only provide relief, but really, get people to heal correctly and function correctly and increase the quality of their lives.
Yeah, that's the most important part, right?
Yeah,
the quality
100%.
of life.
I tell my staff, patients don't come in because they're in pain. They come in because the pain is limiting them from being able to enjoy their life.
Yeah, what they want to do.
And so we want to be able to provide that. And if somebody's goal is to run a marathon, that's our goal. Not just to get you out of pain, but to be able to run the marathon.
Yeah, that's fantastic. Yeah. So do you put plans in place for people, like with all these different kind of, things that you offer?
Yeah, so what we'll do is, after we kind of go through an analysis, go through any imaging and any previous tests they had, and of course, based on what their goals are, we'll devise a treatment plan for them that combines different modalities. Because when you combine some of these modalities together, so just, for example, when you do a stem cell injection, one of the benefits of that is the way the cell works. There's mitochondria, which is the little engine that inside the cells.
Correct.
And we do class 4 laser therapy after those injections because the infrared light actually upregulates the energy of the mitochondria. And
now, are those peptide shots putting more mitochondria or creating new mitochondria in the body?
The stem cell injection does that.
Does that, okay.
Peptide therapy is different. So peptides are short chains of amino acids.
Right.
Okay. You have proteins that are long chains of amino acids, and then peptides are short chains of amino acids. There's literally hundreds and thousands of different peptides that have been isolated in the human body. The most well-known peptide that is in existence is insulin.
Okay.
So insulin is technically a peptide. I describe peptides in the body as compounds that act as catalysts to help support function, as opposed to a pharmaceutical intervention like anti-inflammatory medications or a Tylenol or whatnot. Those suppress function in the body. And
now with peptides, you get that through nutrition normally?
No, it's very poorly absorbed through the intestinal system.
Okay.
And so the peptides are administered in a subcutaneous injection. So it's normally you give it to yourself.
I'm saying normally for a normal person with peptides in their body. How does that work?
No, those are manufactured in the body.
Manufactured within the body.
Correct.
Right. Now, do you only have a certain amount of peptides in your body, or they're manufactured and then?
They're manufactured, but because of things like stress and lifestyle and poor diet and that type of thing, the body will slow down the production of the peptides. Right. So there's certain. So for example, for the pituitary gland, that produces growth hormone naturally. Right. Okay. But because
the famous pituitary gland guy was Tony Robbins, right?
Oh yeah, exactly. Yeah. So he had runaway. The runaway growth hormone when he was developing. But we normally produce growth hormone in the first 90 minutes after we fall asleep, before midnight, and then throughout the day, periodically, we'll have a pulse of growth hormone. As from stress, high cortisol levels, poor diet, and the things that we talk about that suppress, how the body functions, the growth hormone levels will begin to drop and we don't produce as much. So there's peptides that you can take that help support the natural release of growth hormone
within the system.
Within the system. Yeah. So CJC 1295, Ipamorelin, there's several different peptides that can do that.
And you have a vast, you determine that per individual?
Yeah. That's done, and it's administered through our nurse practitioner. We have an APRN that, she's been doing that 40 years. So she does any injection therapies or,
And when you get an injection of peptides, what's the process? Is it just a shot and then you're in and out?
Well, no, we train the patient how to self-administer it. So it's a subcutaneous injection using a small insulin needle. My wife, Heather, she's needle phobic, terrified of needles. She can't even watch on TV if they're even, injecting somebody on an IV. She could, I can't watch it. I don't know what it is, just a phobia she has. Yeah. But she can give herself an injection. So anybody can do it. It's not that, it's just a little, not even a bee sting,
Right.
But it's, self-administered. So things like BPC 157, which is the one that helps support connective tissue, tendons, and ligaments and so forth. You give that to yourself on a daily basis.
Okay.
Initially, and then it can, be every other day for a maintenance type of thing. Other peptides can be, given once a week or once a month. So it just depends on, what peptide somebody needs.
Right. Now, Sarasota Sports Medicine, I mean, it's more of a, the name Sarasota Sports Medicine, but it's a whole wellness application for anybody who comes to see it.
Well, the exciting thing is, in that I was dealing with a couple of things yesterday, and talking to kind of a world famous Dr. Fab Mancini yesterday, who is huge. He's a chiropractor as well, but he's huge in the Make America Healthy Again movement with Mr. Kennedy. We just had an initial meeting. It was a integrative medicine consortium here in Sarasota with Dr. Chris Davis with Reveal Vitality, some other physicians and whatnot, and we're building a network of integrative physicians that can really help this area really, have access to quality healthcare that is going to promote healthcare, as opposed to just medications and surgeries and things of that nature.
Yeah.
So
the old school method. So
Yeah. Well, just yesterday I had a lady come in a young lady come in, and she, is having hormonal problems. She's at that age. And, I refer her to one of the docs that I met at that event that specializes in women's health. And it's not just like, oh, your hormone levels are fine. How do we optimize those levels and make sure you're really healthy? Another new patient yesterday was somebody that had high blood pressure. He's on a statin medication. One of the side effects of statin medications is, chronic, muscle aches and pains and that type of thing. And his primary care physician or his cardiologist has not offered him an alternative. So I referred him to Dr. Davis, who's trained as a cardiologist, but it's integrative medicine. So the real difference,
because there are other options out there.
Well, the real difference is in traditional medicine, it's a business. They're trying to just ram you through the system. Here, take this drug. You don't even
flavor of the day.
Yeah,
drug.
you see the doctor for
5 seconds.
35 seconds out of after waiting for an hour and a half to go and get in to see him, and they're
when the appointment was an hour and a half before.
Exactly. You could have just said, here, look at my information, and here's my vitals, and here, write the script, because that's really what
you're going to do anyway.
Yeah, exactly. Yeah. So with integrative medicine, it's really focused on the patient holistically, not just like analyzing the heart.
And not just try this drug and then try, that one didn't work, try this one, and try that one. Oh, you having that problem? Oh, try this one instead. I mean, you're a pincushion.
Right. Really. And, the challenge with this is that many people, they just want to take a medication. Look at the drug ads that are on TV.
They're all over the place.
They run those ads because they're successful.
Of course.
Yeah. So people are going in, I want that drug. As opposed to an integrative medicine, oftentimes it comes down to teaching the patient about lifestyle. What you're putting in your mouth, the stress, the lack of exercise, sitting too much. And, it's more of a team approach of not only different physicians and caretakers, but then also the patient themselves has to participate in their health and wellness.
Of course.
Yeah. So a lot.
But I think most people that would be coming to explore this, lifestyle,
they're already thinking that way.
They're already thinking that way.
Yeah. They're like, I don't want surgery. I don't like taking medications.
Well, everybody has seen what medications have done maybe to their parents or to their spouse and how it affects, life, or maybe even themselves.
Yeah.
There's alternatives to that side of the equation.
Yeah. I mean, and there's, I think there was a big turning point during COVID when they were pushing, all these mandates and distancing and all this stuff that was not based on any science at all, and then pushing the vaccine or the shot that they were, and, the people started to sit back and go, well, wait a minute. What? That doesn't make any sense. And then they started to kind of think about it. So there's a lot of people when they come in, they always have to research Dr. Google before they come see us.
Okay.
Or they see anybody, they always research their stuff, but they're at least more engaged. They want to know more of I don't want to just take a medication. Why do I have high blood pressure?
Well, that was the way it was, right? I mean, you went to see the doctor.
Mm-hmm.
And I was brought up as the doctor told you to do it. You got to do it as a doctor.
Yeah.
But you go in, you see the doctor, you get this is what you take this, and that's what you believe to be the truth.
Right.
Obviously that's, in my opinion, has failed America, has failed people's health care, has failed the system.
We consume way more drugs than any other country in the entire world, and we have one of the worst health outcomes in any other country in the world.
I know, right? The fat American, right? The fat American.
Yeah, exactly. Yeah.
I mean, it's really sad.
Mm-hmm.
It's really sad.
Yeah.
So How do people, what's the first step when someone wants to come to see you first off?
Yeah, first step is to, schedule a new patient appointment. Patients can do that right online on, our SarasotaSportsMed.com.
And I'll have everything for you guys on the bottom of this podcast, so you have all of Dr. Ken's information.
Contact information.
Get right in touch with him.
Yeah.
Or his office or his website.
Yeah. So they can either, call and speak to Joanna at the front desk. She is my front desk manager. They can book online. They can go ahead. There's a, book online button and at the top on the page. And it's just schedule an appointment. Come in, get an evaluation, kind of see if you might be a candidate for, some of our treatments. If it's a, joint injury or something, we may need to get an MRI. We can facilitate that in very short order. We have relationships with several of the MRI centers around town.
Because that's huge, man. Some of these MRI places,
yeah.
My uncle went through it the other day. Like, oh, you got to get in, you got to do this, you got to do it.
Yeah.
They were like, oh, it's 4 weeks out. He was like, what?
Yeah. Well,
the guy's telling him I'm having a problem.
Yeah. So what we do is, we encourage our patients, unless they really want to use their insurance, is to just do self-pay.
Yeah.
So for, some...
Well, you could always self-pay and then submit later, right, to insurance companies?
Yeah,
you
you
can
can, submit it, see if it goes to
see
your
if it goes
deductible
through,
or whatever.
Yeah.
But what happens is, especially, it depends on what the carrier is. And one of the things that we don't take any insurance.
Right.
Okay. We stopped taking insurance probably about 10, 12 years ago.
And it's not unusual for that space.
Right, exactly.
Yeah, at all.
But it was the greatest decision I ever made because it created a dynamic. It changed the dynamic of the doctor-patient relationship. Initially it was like, the patient would come see you and it was like, okay, this is worth my copay, so it's worth my $30 or whatever it is. And then
it elevated the doctor-patient relationship.
Tremendously because, if a patient's paying us their hard-earned money, for us to provide a service, they're not buying a service, they're buying a result. So we'll do everything that we can to make sure that they get the result they're looking for. So it really changed that dynamic. So we encourage our patients to just, do self-pay if possible. Medicare is a little easier to use, and we have our nurse practitioner can write that order, and Medicare will cover it. But like some of the carriers, they won't do an MRI. They won't approve an MRI right away. They're like, oh, well, you haven't had an X-ray. Well, an X-ray is not going to show. Meanwhile, they have a torn labrum. That's not going to show up on an X-ray. So, and then they'll say, well, absent any findings on the X-ray, then they have to do 6 weeks.
We shouldn't even get into the
therapy.
Insurance thing, really.
Yeah, that's a whole story. But point being is that you can bypass all the headaches and all the roadblocks that they try to put up by just paying $300, get an MRI, and we can get that facilitated. Usually,
because MRIs, they used to be thousands and thousands of dollars.
Well, I've had patients say that they tried to use their insurance and their copay was $800, but they could self-pay for $300.
I know. Yeah, it's like wild.
And usually within 24 or 36 hours, we got the report already.
Yeah.
And so then we can go ahead and design that care plan and get the patient taken care of right away. So the initial process is just contact the office and schedule a consultation, and we'll sit down and try to resolve and find a solution to the problem.
Absolutely. Well, Dr. Ken Kaufman, guys, Sarasota Sports Medicine. It was great having you on today, my friend.
Yeah, hopefully it wasn't too heady.
No. Yeah. I think we hit some great topics, great thoughts. This is a series, I think, here because there's so much information for you to share. And, with all the new things happening for your practice and the new
Make America Healthy.
And putting that doctor group together is just huge.
Yeah.
Just a huge asset for your patients and people in the area here. So if you'd like to see Dr. Ken Kaufman at Sarasota Sports Medicine, please click the link below, get onto his website, and make an appointment. And Ken, thank you for being here today again, my friend. Pleasure. Yeah. We'll see you again soon.
Yeah.
I am Robert Dinan, all things luxury, all things Florida, and I will see you soon next time. Thanks for being here.